The World Health Organization, the WHO, and the United States Center for Disease Control says that there's an imminent threat of widespread measles outbreaks in regions across the world. This after lockdowns due to the COVID-19 pandemic resulted in a decline in vaccination coverage and less active surveillance of the disease.
Delivering a joint report, the WHO and the United States CDC says a record high of nearly 40 million children did not receive a measles vaccine dose in 2021 due to restrictions implemented in response to the COVID-19 pandemic. Measles is highly contagious, and a 95% vaccination rate is required to prevent outbreaks. Experts attribute the lack of a dramatic rise in the number of measles cases to lingering social distancing measures and the cyclical nature of the disease. They, however, advise immediate action, with the expectation of a challenging 12 to 24 months of trying to mitigate the spread of the illness. The WHO has already observed large outbreaks since the beginning of this year and is particularly concerned with potential outbreaks in sub-Saharan Africa.
Well, for a little bit more on this, we're now joined via Zoom by Dr. Bwaka, who's the acting team leader for the Vaccine Preventable Diseases Program for the World Health Organization Regional Office for Africa. Thank you so much indeed for joining us. Welcome to the program. We're starting to see measles cases. Is there going to be an explosion, or is there going to be a gradual increase in the numbers?
Thank you for the opportunity to be on your channel live. Thank you for the question. Yes, as rightly said during the comment report I've just made, the region has experienced an increased number of measles outbreaks, and this is due to partly to the COVID-19 pandemic. And it's expected that if care is not taken, we may experience some more outbreaks in the coming years or months. Yeah.
Tell us how measles spreads, how it breaks out, and why this break in vaccinations has become potentially very dangerous for us.
No, vaccination is not dangerous for measles.
Not the vaccination itself, the lack of vaccination.
Oh, sorry, yeah. Measles is a very highly infectious disease, and the virus circulates and pass from one person to another person when the immunity is very low, and especially children below the age of 5 years. These children are not vaccinated, so they have the risk to be contaminated by this virus. Then it can easily explode to an outbreak when conditions are well organized for the virus. So the vaccination is one of the very cost-efficient intervention that can prevent these outbreaks to occur.
How many vaccinations do children have? It's more than one, if I remember correctly.
Yes. What is advised is that children can get first dose of the measles-containing vaccine before the age of 1, before the first anniversary of their day. And then a second dose is advised between the age of 12 to 15 months. The coverage for a district or an area is supposed to be not less than 95%, so that we can expect a good immunity within the community and within children that have been vaccinated.
All right. So currently, I suppose because of COVID, we have a number of children who haven't been vaccinated at all, and another batch of children who've received just one vaccine. Both groups equally vulnerable?
Yeah, those that have never been vaccinated and have passed the minimum age of 9 months are really exposed to these outbreaks. Those that have received one single dose and have passed the age of 12, 15 months, for example, they are also at risk of being infected, even though the first dose that they received provides them some level of immunity. But it's advised that the children that has been vaccinated with the first dose get a second dose when this second dose is due, and it provides them more immunity.
How do we get these vaccination programs back on track? I would think that we learned a lot from COVID, even though it disrupted the measles vaccination program. But we learned a lot in terms of how to roll out these programs, I'm thinking.
Yes, I think efforts have been made to bring back the program on track. We have WHO with partners have developed guidelines. There's actually a strategic plan to control or eliminate measles by 2030, and the support from government, from partners, from communities, civil society organizations, NGOs, is required for us to have vaccines available and the service provided to the community, and then also improve the demand from the communities and make sure that these vaccines are provided right to the very remote areas so that the children can be reached with the vaccines.
Do the various health authorities have enough resources to get the job done? Or is it just a question of getting the parents to go to these clinics and be reached in the rural areas?
There's a combination of factors that need to be tackled, a lot of challenges. Not only resources need to be made available, government need to allocate enough resources for vaccines to be purchased and vaccines to be transported where they are needed, but also increase the community awareness about the availability of these vaccines. There are other factors like conflict areas, insecurity, where strategies need to be developed to make sure that these vaccines are also reaching these communities.
We saw a new phenomena, vaccine hesitancy during COVID-19. We saw in parts of Nigeria there was reluctance to get polio vaccines for one reason or another. Is this something that you're starting to see with measles, given what they saw with COVID-19, or are all parents desperate to get their children vaccinated?
In general, in the African region context, measles is well known by the community as a very deadly disease, very dangerous disease. So basically, we have very, very little hesitancy to this vaccine. What is being described is basically some of the hesitancies in some religious communities where vaccines are not accepted at all. But in general, measles vaccine is well accepted by the community.
All right. So which areas seem to be most vulnerable at this stage across the continent?
Yeah. Areas where we have conflict are basically areas where the vaccines are not reaching the children. We also have what we call underserved communities or populations, and these are hard to reach areas, remote areas, even in urban slums or peri-urban communities. These are places where we have children that are most likely not having access to these vaccines.
I know that for planning purposes, you've got to plan for a worst case scenario. If this thing isn't managed, how many children in particular, potentially in our region, could be susceptible to measles?
Yeah, planning is being done in such a way that in addition to routine immunization that are provided on daily basis, on weekly basis, countries also carried out what we call catch-up campaigns. And these are preventive campaigns that are supposed to be organized every 2-3 years so as to avoid the accumulation of children that will be vulnerable to any outbreak of measles. So we expect that if care is not taken, because of the increased number of cases that we are notifying, we may have some resurgence of measles outbreaks, and this can go to thousands of cases that we have had before. In 2019, we had almost the very highest number of measles cases that have been notified since 1996, and this went to about 800,000 cases of measles reported in the region.
All right, there might be parents watching right now, and I just wonder if we can help them in terms of symptoms and signs that they can look out for, that they probably should say, okay, this might be serious, this might be measles, and what do they do?
Yeah, measles is well known by parents. Basically, the simple definition of measles is made of fever above 38 degrees centigrade, with what we call the 3 C's, cough, running nose, and running eye.
All right, and what should parents do?
So when a child has these symptoms, what is advised is that the parent go to the nearest health facility, report, and see the health worker who is trained to suspect this case of measles and provide the necessary care that is supposed to be given. And then there's a monitoring system by the health worker until the child recovers from the disease. Yes.
Dr. Bwaka, thank you so much indeed for joining us. Thanks for your time.
Thank you.
All right, that's Dr. Bwaka, who's the acting team leader for the Vaccine Preventable Diseases program for the World Health Organization Regional Office Africa, explaining to us the vulnerability that we're under at the moment in terms of measles, particularly acute in children between just under the age of 5. And this was disrupted, of course, by the COVID-19 pandemic, where a lot of the measles vaccination programs were disrupted.